Hi, this is Doug and Cindy with Help Me Help Mama 5cast. Thanks for joining in today. We recently had a viewer ask about Geriatric. I think in one of our prior episodes we mentioned Geriatric, which is short for Geriatric Psychiatric Facility. Asked what that was, that a doctor had recommended that for his mom. So today we're going to take a few minutes and talk a little bit about Geriatric facilities. So,
okay.
Cue Cindy.
Okay. So at some time in the past, I interviewed an administrator from a geriatric psychiatric facility, and I want to go through some of those questions and his answers today. We're not going to be able to cover everything we need to, so I'm going to hit the high points, and at another time we'll go into more detail. So, Geri-Psych is geriatric psychiatry. This is mental health services for our older adults. Now, they treat a number of issues, but primarily what we've seen is treatment for dementia or treatment for the behaviors associated with dementia. Now, often these behaviors present in the form of agitation in the person with dementia because they don't understand what's going on. When you and I have a thought, we want a result, we make those two connect. Person with dementia cannot quite make that connection. Okay? So there's agitation, which in turn, the agitation presents challenges for the caregivers, right?
Right.
We're talking fear, frustration, worry, in the caregiver and the rest of the family. And they're not really sure how to handle these behaviors. So if this is you as a caregiver, you may be thinking, oh, goodness, Mama's lost it. What do I do? Enter the Geri-Psych. So, a typical example of where geriatric psych helps in another realm is if your loved one is in a nursing home and let's say they've been there for a while, everything had been going along just the same for months and months and months, and all of a sudden they have some behavior issues. The nursing home staff doesn't know what to do because they don't know the underlying cause of this behavior issues, the changes. So they will refer the resident to the Geri-Psych for an assessment, and then they can provide treatment to the very specific situations that the geriatric patient needs with the mental health problems that they are having.
Or sometimes if mom's at home and having issues, her doctor can recommend Geri-Psych. And it makes a lot of sense because otherwise the doctor's just guessing. A lot of times, a general practitioner may say, well, here, take that. Well, that may work, may not. But a Geri-Psych facility, you're in there, mom's in there for usually 10 days to 14 days, and they try this, that, and other, and they get it to the point where eventually it works as good as it's going to work.
Okay, so what is a Geri-Psych facility? If you think of these old movies that you've watched to conjure up pictures of an insane asylum, big, tall brick buildings with padded cells. That's not it. The specific one that I toured for this interview had 16 beds, which meant they could treat 16 patients at one time. It was set up like a home environment. They had a day area over here where a patient could go sit and watch TV, another area where a patient could sit down with their family members, or they could go to this area and sit down and play cards or whatever with their other patients. There was a separate space for the staff offices.
Most of them are just wings of a hospital, right?
Exactly.
Just a section of a regular hospital.
So you're wondering, well, what can happen typically that would trigger a need for a Geri-Psych? Answer is something is happening with your loved one's mind which doesn't allow them to process the daily events like you and I can. People with dementia who struggle with psychosis, this is a trigger. If they are seeing things that nobody else in the room is seeing, or if they're hearing people that everybody else in the room, nobody else is hearing, something is going on to the point that it's affecting their functioning. And they're unable to explain to you what is going on with them. And you as the caregiver, you're sitting there thinking, what do I do? Who do I ask for help? Where do I find them? Where do I go? You don't know what to do. So this is where Geri-Psych comes in to help. So maybe your loved one is suffering from depression. That's another place where they can help. A big portion of our population suffers from depression. And often when you're talking about depression and dementia, you can see that so many of these patients struggle with that in ways that, say, they lash out. Because oftentimes they get agitated because they're not able to connect thought with result. And
that's what we see a lot of times, angry. They're just
Mm-hmm.
angry if people dump a cup of milk on their caregiver or something like that.
or hit Yeah.
someone or get real confused. They don't know where they're at. They're out in public and just totally lost, acting inappropriately.
Absolutely. That's probably all we've got time to go over today.
And sometimes in real life, we've had a lot of clients go through Geri Psych, and sometimes we just think they're miracle workers. They just do amazing things. Sometimes it doesn't make any difference at all. But, it makes a difference in enough people that if your doctor prescribes it, it's definitely worth a try because it helps a lot of people. And sometimes it's just temporary, but it can really make a difference for a big percentage of people, and it's definitely worth checking out. So hopefully this information was of value to you today and helped. If you've got a loved one that's suffering with some of these issues that Cindy talked about, maybe worth talking to the doctor about in your next visit. So thanks for watching today. Hope you are having a great week.
And thank you for being a caregiver for your loved one. You're making a huge difference in their life.
If you like this video, give us a thumbs up, and if you want to see more videos like this, click on the subscribe button to subscribe to this channel, and click on that little notification bell to be notified the next time we do a video.
And if you want to interact with us, check out the description below and leave us a comment and let us know what legal or caregiver topics you'd like to hear about.